Hey, Long Beach, this is Mayor Robert Garcia, and we're here today for another update. We, of course, have our updates on Monday, Wednesdays, and Fridays at 3 p.m. This is April the 17th, this Friday, and I also want to welcome and thank Dr. Davis, who is here with us to also give an update and answer questions, as she usually is. And, of course, also I want to thank Teresa Ayala Castillo, who is going to be who's from the Health Department, who will be translating a summary of today's briefing in Spanish at the end of the briefing and after the questions from the media and the press. So we have a lot to update today, and actually there's a lot of, I think, good news to update today as well. And so I want to let folks know that there are some really positive developments that are happening. But I want to begin by giving everyone the overall picture of where we are from a data perspective, and then talk about testing and some other items as well. The first is I just want to thank everyone. Vast majority of folks have been very, very compliant and have been doing the right thing as it relates to our stay-at-home orders and safer-at-home orders, so thank you for that. As of today, I want to just begin by saying that the Long Beach Health Department, we are reporting a total of 419 positive cases. And so, of course, we know that that number increases every day as more folks are tested and are tested as positive. But I will say, of that 419 number, the one piece of good news is that about 220 of them have actually recovered. And so we have reported recoveries of that 419 number. And so those are folks that are now at home, they're healthy, they're better, and we're very heartened by that and grateful for that. We also, of course, have folks that are still very sick and that are hospitalized. And so this still is a serious pandemic, as we know, across the country and the world. And we have that 419 total caseload right now. I want to share also that we have 105 positive cases that have been confirmed at all 7 of our long-term care facilities in the city. And so as we have noted in the past, our long-term care facilities, our skilled nursing homes, are a big concern for us and an area that we continue to monitor very carefully. I know that last time we gave a briefing, we had 18 deaths. I'm sorry to report that we are at 20 deaths across the city. The 2 individuals that have passed were both in their 80s, had other also underlying health conditions. One was male, one was female. And as a reminder, of the 20 that have died, they have all been in their 50s through their 80s, and so that has been the range. But again, as a reminder, younger folks especially can have no symptoms and continue to carry COVID from person to person and to our senior population as well. And so our prayers and love go out to the families, as they always do, during this really difficult time for them. But I want to transition to testing. And I want to share some very good news as it relates to testing. We're all aware that when this crisis happened, there was a national testing shortage. Long Beach, like many cities across the country, were expecting to receive many more tests from the federal government and our other partners, and we were not getting the tests that we needed. And so what did the city of Long Beach do? We began, of course, by having a small testing center at the Long Beach Health Department. We focused on first responders. Then, soon after that, we opened up our first drive-through testing center at Long Beach City College at the Pacific Coast campus. And that has been successful. And we're seeing, of course, every day there at that site, 60, 70, 80 folks that come in through that drive-through testing center. And again, thank you to the County of Los Angeles for that partnership. And so that also opened up. And of course, we've been having private testing. So doctors are sending individuals to get tested at private labs, as are our hospitals. And so there's been testing being done in a variety of different ways. But today I'm really pleased to announce that starting this weekend, we are going to be more than tripling our testing capacity in the city of Long Beach. And so we're announcing 3 new testing sites that are starting this weekend in North, West, and Central Long Beach. And so I want to explain what we're doing. Let me begin by saying that I want to thank first Long Beach Unified School District, because 2 of these sites are on campuses. And so we're going to be opening up our first testing site in North Long Beach at Jordan High School, which is at, of course, 6500 Atlantic Avenue. Our next testing site we're opening up at Cabrillo High School, which is in West Long Beach at 2001 Santa Fe, and most folks know where Cabrillo and Jordan are. And we're opening our 3rd testing site at St. Mary's Medical Center, at St. Mary Hospital, right there on the campus of St. Mary Medical Center. So these testing sites, of course, now are greatly grow our capacity from our 1 testing site now to 4. And all 4 are a little different, but I want to share a little bit more information. First is that all the testing will still be done by appointment. And you'll be able to access the testing sites through the Long Beach COVID-19 website, which is through the city website. There will be a testing landing page on the testing site. And these tests, of course, will be prioritized and screened, especially for those that are over 65 and have chronic symptoms. The site at Long Beach City College will remain a Long Beach and LA County partnership. The 2 sites with Long Beach Unified School District at Cabrillo and at Jordan are City of Long Beach sites, so those are completely run by our Long Beach Health Department. And then the St. Mary's site is a partnership that St. Mary Medical Center is operating on their site. But all 4 are open to the public. There's no cost, and we will see anyone, whether you have insurance or not, whether you're documented or not. Our goal is to get everyone safe and tested that needs a test. It's also important to know that the 4 testing centers have different hours of operation, and all that information will be on the website. And so we encourage folks to look the sites up and to get when they're open and when they could serve the public. In addition to that, I want to add that and I'm really proud, I want to thank our team at the city and the health department, because when we realized, like many, that the tests weren't going to come to the city as we expected from our federal government and partners, we went out and got our own tests. And so the 2 high school sites are tests that the city of Long Beach went out, our team went out and personally went out and found, purchased, and are now in operation. Beginning this weekend, our capacity will grow to be able to perform over 500 tests every single day. So our drive-through capacity before was approximately 100 tests, and we're going to grow to over 500. You can, starting this evening, you'll be able to visit the COVID-19 website, click on the testing link, and begin signing up for these tests, including this weekend, the 2 sites at Long Beach Unified. And so I want to thank our partners, the Health Department, Long Beach Unified School District, the board, members of Long Beach Unified, and the superintendent, as well as St. Mary and their entire team for this amazing partnership and the continued partnership at Long Beach City College and the county. And so it's a lot of good news to report as it relates to testing. Long Beach is going to dramatically increase our testing starting tomorrow. And it's needed, especially as we think about the next steps on the road to economic recovery. Now I want to transition to some more, I think, good news. We have been committed to putting out information and being transparent about data and about the public's right to know what we know as positive cases come out and recoveries come forward. Also, later tonight, we're launching an all-new COVID-19 website at longbeach.gov. That website will be easier to navigate, easier to use, and have more information for users. As part of that website, and this I think is the most exciting part, is we're also launching a new dashboard that will be available later tonight. And I want to share what this dashboard is going to look like. You might see now up on your screen just an example of what this dashboard will actually look like and the information that will be available. Now, please note that the information you see currently has not been updated because it's not live yet. And so once the dashboard is live, which will be later tonight, all the information I gave today will be updated, and then it will be consistently providing real-time information whenever visited. And so as you can see, this new dashboard will provide information about the total number of cases, currently hospitalized, total deaths, those that are recovered. It will give an update on where the cases are across the city, broken up by zip code. We'll give you an idea of the gender of the positive cases, also the age group of the cases, and we have also graphs and data as to how the city of Long Beach is performing as it relates to the County of Los Angeles and the state. And also, which I think is really critical, is you'll be able to see our hospitalizations, our ethnicity and race numbers on graphs that will be accessible to you whenever you want to see them. And so moving forward, beginning this evening, the public, anyone, can access the longbeach.gov website, go to that dashboard, which we just showed you a preview of, and look up the information as it's happening. And so we're really proud of the team. This has been really important to get this done. And so I'm excited to be able to launch that dashboard and get that going beginning tonight. I want to now transition to some information as it relates to older adults and seniors. Dr. Davis is about to give an update about all of the programs we have as it relates to seniors, but I want to just name one and uplift one of those programs. The City of Long Beach began working with, we're probably aware of the world-renowned chef Jose Andres and his amazing work that he does globally. He and the organization, World Central Kitchen, which is an organization that's springing up across the country that assists getting meals to seniors and those that need meals. They are in Long Beach as one of the sites across the country where they are operating. World Central Kitchen is a great partnership that reached out to the city, which we've been doing, connecting them as well to some of the restaurants, including Lola's and others. And this amazing organization is getting restaurants to cook, prepare, and send meals out to all the seniors in need. Currently, we are providing senior meals to Plymouth West, Park Pacific Tower, City View, Providence Gardens, the Senior Arts Colony on Anaheim, and Little Sisters of the Poor, who are in San Pedro, who's also a partner. World Central Kitchen is really an amazing organization, and the connections being made from the restaurants to the organization are incredible. And I just want to thank the restaurateurs, World Central Kitchen, for the amazing work and the partnership that they all put together. This is their work, and I want to thank them for that. But I also want to thank UPS, because UPS, which has a huge presence here in Long Beach, is delivering these meals for free. And so these meals are being made and prepared at these restaurants. The restaurants are able to hire their workers back and produce this food, and then UPS is delivering this food out across the city. And so thank you to UPS, thank you to World Central Kitchen, and to all of our partners within the senior community. And with that, I want to pass this over to Dr. Davis.
Thank you, Mayor. There's no doubt that everyone is impacted by COVID-19 in some way, but it's not affecting everyone in the same way. The Long Beach Health Department is paying close attention to those who are being hardest hit by COVID-19. As the mayor has stated previously, recent data shows a disparity in positive and hospitalized cases that are affecting the African American community. This virus most severely impacts those with underlying chronic health conditions such as asthma, diabetes, and high blood pressure. And we know that our African American community disproportionately has higher rates of these conditions. As we continue our COVID-19 response and recovery efforts, it's important that we acknowledge these disparities and use this information to help us best respond to those who are most impacted by this virus and have less resources to recover. By increasing our free testing locations throughout Long Beach, we are able to provide more opportunities for all residents, if they test positive, to be supported while in isolation and to acquire quick treatment if needed to prevent further complications, potential hospitalizations, and community spread. We want to ensure all our community members remain safe and healthy during this pandemic. So now I'd like to briefly talk about some resources for older adults. Also consistent with COVID-19 data from around the world, Long Beach has seen an unequal impact on our older adult population. And older adults self-quarantined in their homes may face unique challenges to meet their physical, social, and emotional needs. To combat this, we're working hard to make sure our seniors have the resources and care they need at this time. Yesterday, the City of Long Beach provided an update on many of the resources available for older adult residents, who are typically considered over the age of 65. Numerous organizations, including our health department, are providing the services, and I'd like to share some of those with you today. The health department launched the Older Adult Resource Line in March and provides callers resources for food delivery, home supplies, prescription delivery services, utility restoration, and mental health resources. It's available every weekday from 8 a.m. to 4:30 p.m. by calling 562-570-INFO, or 4636, and selecting option 5. Meals on Wheels is providing fresh, hot dinners and cold lunches and is also currently recruiting additional volunteers to support these services. Call 562-439-5000 and select option 0, or visit their website at mowlb.org. Salvation Army operates a food pantry and delivers food boxes to older adults in quarantine as well as families with restrictions. Call 562-247-3528 for more information. The LA County Department of Workforce Development, Aging and Community Services is providing temporary free delivery services of groceries, household items, and vital necessities to older adults, dependent adults, or permanently or temporarily disabled individuals who are unable to leave their home due to COVID-19. Call 888-863-7411 for more details on eligibility. Heart of Ida, in coordination with the Long Beach Senior Police Partners, established a friendly caller program to match trained and caring volunteers with older adults who may feel socially isolated. To volunteer or participate, call 562-570-3548. I want to thank all of these volunteer organizations for all the help that they're providing our seniors at this time. So I just want to end with a little bit of information about antibody testing. There's been a great interest from the public to obtain antibody tests to determine past or present COVID-19 infection and potential immunity. However, antibody testing is really still in its infancy, and there's actually very few tests that have been FDA approved. Most tests that are out on the market right now have not been FDA approved. There are studies that are ongoing to determine the accuracy and usefulness of serology testing. One of these that was recently done was with the Los Angeles County Public Health Department, who partnered with the USC Price School of Public Policy, and they did a regional COVID-19 antibody study where they took a random sample of 1,000 adults living within 10 miles of 6 different testing sites. This study and others like it can help us understand the current and past prevalence in the community, how far the pandemic has progressed, and in the future may potentially inform strategies for return to work, along with other clinical data. So at this time, the Long Beach Health Department is not doing serology antibody testing, but this could change in the future as the testing evolves. We will continue to do our part in response to this pandemic with testing, education, and assistance to our residents. Thanks again for all of your sacrifices in staying home to slow the spread of this disease. You're helping to make our city safer and healthier each day. As always, for all of the latest information, continue to check our website, www.longbeach.gov/COVID-19. If you have any questions, call our info line at 562-570-4636. You can also follow at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you so much. And we're going to go ahead and take questions from the media that we have. So I'll go ahead.
Okay, first up, we have Rachel Jordan from ABC News.
Okay.
Thanks. So this question is for Dr. Davis. I wanted to know if there was any more information about the first homeless patient that was reported on Wednesday.
Oh, I can tell you that he is a male. He's middle-aged, and he's actually been cleared, so he's recovered.
Next, we have Valerie from The Post.
So this is about the disproportionately.
Valerie, you're going to have to speak up a little bit. We can barely
Sorry.
hear you.
Can you hear me now?
Yes, thank you.
Okay. So because they're disproportionately affected, Long Beach said it's providing more social distancing education and resources to African American households. But other than the new testing centers, what does that support actually look like on the ground? Can you tell us what service or services the city's actually going to provide and when?
I think we can maybe both answer that. Let me start. I think step one was it should be no surprise where the new testing centers are. It was we know obviously where the community needs additional support, and so in particular our location in North Long Beach was selected to ensure that we were also closer to a population there as well. I was on a call, maybe it was yesterday or the day before, also with members of our faith community, a lot of leaders within the African American church community, our Ministers Alliance, and we discussed also this very topic. And so we are working with our faith community. We're going to be working with a lot of the organizers that are doing work on the ground and our community organizations and nonprofits, and then ourselves coming up with plans on how we do a better job of reaching out. Part of what we're going to do, we hope to launch pretty soon, is we're also going to be doing smaller mobile testing units. We are creating smaller units that can go into a neighborhood, and the unit could then provide not just testing to a small area, but also education services and provide connections with folks within that community. And so our hope is to meet people where they are and to go into neighborhoods in a much more direct way, especially neighborhoods that are being disproportionately affected, to get information out, education, and tests. And so that's part of it. But there's a lot of work to do, and I don't want to say that we have the complete solution. We need the public's help, but just know that we take this very seriously, and while it's a national issue, it's disheartening, and it's not something that we should accept as okay. And so we're working on it. There's a lot more work to do. Mm-hmm. I think Dr. Davis, I think I covered most of that. Mm-hmm. And so those are some of the programs we're working on.
All right, next up we have Haley from Southern California News Group.
Hi, my question is about testing. As testing capacity has increased in the city, have the guidelines changed for who should be prioritized for that testing?
So it's still important, because we have limited testing supplies throughout the country, that we're judicious with our testing. But The main thing is that you should have symptoms to be tested. So I think that we're just going to be able to expand, being able to test more people that have symptoms to be able to rule in or rule out whether they have COVID-19 infection.
I think that's right, and I'll add that you've seen the county also, when they first launched their testing program to now, and I think as it relates also to our health department, earlier, I think the rules around who was being tested was just a little more stringent than it is today, and they've relaxed and opened up some of it just because there's just more availability of tests. But let's not create a false sense that there's all of these tests that are the available tests that we need. We had to go out, like I said, and get our own tests because we weren't going to wait around anymore. And so while testing capacity has now dramatically increased for Long Beach, we still need to do screening. We still need to prioritize those folks with symptoms. I would encourage individuals when they go to the testing website, the different sites and the different centers have all of the screening information as they walk through that. But testing still is going to be triaged to those that need the testing the most, which are older adults, those with symptoms, and those that maybe have another different type of underlying health condition. And let me add one more thing. Our rapid response clinic at Long Beach City College is also a great place to get information. If you want to go, and particularly if you're uninsured, go get assessed, go get information there. And they have also, when they've looked at folks at the rapid clinic, if they feel that you are a candidate for a test, you will get asked also at that point, you'll get referred to do an exam as well.
Okay, we have a couple of questions that were emailed in. The first one actually they're both from Bill Pearl, but the first one is regarding Community Hospital. Within the past week, with whom by name have you spoken at the California Department of Health, in the governor's office, or with the lessee operator about its current status? What did they tell you about why it's not open? What did the state agency and the operator now say it will do? And can you give the public a date certain when it will begin doing it? That's a very multi-part question. So
I'll try to just summarize. The decision on when the hospital will be opened is up to the California Department of Public Health. So it's not up to the city. Obviously, they have to receive a license. The hospital has to receive a license through the state. And so we're all waiting on the state to provide that license, and they're working things out with the hospital. We're all anxious for it to open. And I would, I don't have a list in front of me of who spoke to who when, but I would say we've spoken to all of the parties that were listed. Someone from the city at some point in the last week or 2 weeks. So whether it's been governor's office staff or the Department of the California Department of Public Health, I'm sure I haven't directly spoken to them, but I imagine someone at the city possibly has. And certainly the city has been in contact with the hospital group that's opening up.
thank you. And last question, also from Bill Pearl. San Francisco has shut down roughly 80% of its bus lines. The city of Carson has shut down all of its bus lines and called on LA Metro to do likewise. On March 22nd, Long Beach Transit halted about 35% of its bus lines. But to our knowledge, they instituted some operational changes, such as rear door entry. Since a disproportionate number of our Long Beach African American residents are now hospitalized with COVID-19, and city management has acknowledged they're among demographic groups frequently using mass transit, should Long Beach Transit and LA Metro be doing more than they're doing to reduce the spread of COVID-19, including further reducing their operations?
Sure. I think let me answer that two ways. So one is both LA Metro and Long Beach Transit have changed the way they operate as it relates to cleaning the buses, where individuals are coming on board, additional screening, and are working really, really hard to try to keep the actual buses, the train system, as sanitized as possible. I will say, I do believe LA Metro's ridership is maybe a fourth of what it typically is. Buses and trains are dramatically less full, understandably so. And the same is for Long Beach Transit, which has decreased service, and they continue to look at decreasing service. But I want to be also very clear. There are folks, especially the working poor, people that are essential workers, like the folks that are bagging our groceries, that need to get to and from waking up in the morning to clean our hospitals. We're talking about janitors, grocery workers, low-income people that do not have any way of getting around but to use public transit. And so this idea from some that we should completely shut down the only lifeline for especially the working poor to get around is unfortunately not acceptable. I don't support that, and nor has any major city in the state completely shut down public transit. Instead, we have to work to ensuring that these are safe and clean and sanitized buses and rail systems, and it is hard to do. And so I'm not saying that there's an easy solution to this, but a complete shutdown of public transit is not something that would benefit the working poor that depend on transit as the only way to get, in many cases, to and from work. These are folks that are cleaning our hospitals, that are at our grocery stores, that are working at our docks, and they are heroes in our community for the work that they are doing.
That concludes our questions for today.
Thank you. And with that, I'm going to turn this over to Teresa Ayala Castillo, who is going to give us a summary in Spanish. So thank you.
Buenas tardes. Hoy, como siempre, tenemos mucha información para ustedes. Hoy tenemos 419 residentes con pruebas positivas de COVID-19. Este número incluye 105 casos positivos en 7 centros de cuidado de largo plazo y 220 que han recuperado. Lamentablemente, tenemos 20 muertes de esta enfermedad. Nuestro más sincero sentido pésame a todas las familias y amistades de nuestros residentes que han fallecido. Mi corazón y mis oraciones están con ustedes en este tiempo tan difícil. Estoy orgulloso de anunciar que la ciudad de Long Beach va a abrir 3 nuevos centros de pruebas para COVID-19. Estas pruebas serán sin costo y de autoservicio. Las clínicas serán localizadas en 3 sitios en el norte, oeste y el centro de Long Beach. Jordan High School, 6500 Atlantic Avenue. Cabrillo High School, 2001 Santa Fe Avenue. Y St. Mary's Medical Center, 1050 Linden Avenue. Si se necesita cita previa. Prioridad se va a dar a las personas mayores de 65 años y personas con síntomas que tengan enfermedades crónicas. Hoy día lanzamos la nueva página de Internet que contiene la información de COVID-19. Esta página está más fácil de usar y es un gran recurso para residentes, negocios y organizaciones que necesitan información. Estamos trabajando para asegurarnos que nuestros adultos mayores tengan los recursos y la atención que necesiten para superar esta crisis. Estamos especialmente entusiasmados con nuestra asociación con José Andrés de World Health Kitchen o Cocina de Salud Mundial, que va a ayudar a entregar comida y alimentos a centros de cuidado de mayores. World Health Kitchen o Cocina de Salud Mundial va a dar fondos a restaurantes locales para que cocinen comida y que UPS entregue esta comida gratis a todos los residentes mayores de edad que necesitan este servicio. Para más información, visite wck.org o wck.org. Estamos muy agradecidos de estas organizaciones por su apoyo. No hay duda que todos están afectados por COVID-19 de alguna manera. Sin embargo, hemos visto las desigualdades sociales y económicas que afectan la salud y el bienestar de nuestra comunidad. El Departamento de Salud de Long Beach está poniendo mucha atención a aquellos que están siendo más afectados por COVID-19. Datos recientes demuestran que la comunidad afroamericana tiene mayor riesgo en contractar este virus y ser hospitalizados. Este virus afecta gravemente a las personas con enfermedades crónicas como asma, diabetes y presión alta. La comunidad afroamericana tiene mayor riesgo de estas enfermedades y es importante que hablemos sobre las desigualdades en la salud en esta comunidad. Al continuar con nuestros esfuerzos contra este virus y los esfuerzos de recuperación, es importante que usemos esta información para ayudarnos a responder mejor a aquellos que están más afectados y tener la menor cantidad de recursos para recuperarse. La clínica de Long Beach quiere asegurarse que nosotros, personas mayores de 65 años, tengan los recursos y la atención que necesitan para superar esta crisis. Como todo el resto del mundo, Long Beach ha visto un gran impacto en personas mayores de 65 años y con enfermedades crónicas y subyacentes. Los adultos mayores que están en cuarentena en sus hogares pueden ser muy afectados y no van a poder realizar sus necesidades físicas, sociales y emocionales. Para ayudar con estamos trabajando con varias organizaciones que estarán brindando sus servicios. La línea telefónica de recursos para personas mayores del Departamento de Salud de Long Beach tiene toda la información sobre estos recursos y las organizaciones que estarán brindando estos servicios. Pueden llamar todos los días de 8 de la mañana a 4:30 de la tarde. Esta línea proveerá información sobre recursos de alimentos, entrega de comida, entrega de medicina recetada, la restauración de servicios públicos como luz y agua y salud mental. Para toda esta información, por favor, llamar al 562-570-4636 y oprimir el número 5. Muchas de las organizaciones que brindan estos recursos son apoyadas por el Fondo de Ayuda de Coronavirus de la ciudad de Long Beach, el cual distribuye $475,000 a 31 organizaciones sin fin de lucro de la ciudad. Muchas las preguntas sobre pruebas de anticuerpo de COVID-19. Existe un gran interés en el uso de estas pruebas para determinar si alguien tiene inmunidad contra este virus. Pero hasta ahora, en este momento, hay muy pocas pruebas que son aprobadas por uso y los resultados de estas pruebas deben usarse con mucha precaución. La información es limitada si la presencia del anticuerpo asegura que alguien ya no sea contagioso y por cuánto tiempo dura la inmunidad. Es por eso que la ciudad de Long Beach no va a ofrecer estas pruebas a este momento. Finalmente, para más información, visite la página de nuestra red social en el www.longbeach.gov/COVID-19. Y si tiene preguntas, por favor llamar a la línea de información al 562-570-4636. Si es para adultos mayores, oprima el número 5. Muchísimas gracias.
Y muchas gracias para mirar esto y también vamos a otra vez estar en lunes. Por favor, esté con mucha salud tu familia y muchas gracias. And again, thank you all again for being with us. It's a lot of great information. Please stay safe this weekend. Stay home. And we'll see everybody again on Monday. And we'll continue to put out information through our website and on social media. Thank you.